But first, welcome to the end of day 10. Can you believe it? Or a national shutdown because of a virus that arrived here via China. Now, we have a lot of new information for you at this hour. The number of coronavirus infections in the U.S. now stands at more than 83,000. That's an increase of about 20,000 from yesterday. We're doing a lot more testing. The day before, the number jumped by 11,700. The number of those recovered is 1,864. And the number of those deaths is at least, now those who have died, at least 1,201, an increase of 314 from the previous 24-hour period. The day before that, deaths rose by 212. So we're not at peak, at least not yet, and certainly not in the nation's COVID hotspots. Now, New York, doesn't surprise you probably, remains the epicenter of this virus, with 55% of all new infections and 1/3 of all deaths occurring there. Governor Cuomo offered some good news on the issue that people were understandably freaking out about just a few days ago. That's the question of the availability of gowns and masks.
Equipment and PPE is an ongoing issue. Right now, we do have enough PPE for the immediate future. The New York City hospital system confirmed that. So we have enough in stock now for the immediate need.
But he offered another stark warning on ICU beds and ventilator needs.
Ventilators, ventilators, ventilators. We're still shopping for ventilators all across the country. We need more. The hospitals have a 53,000 bed capacity. We're trying to get to 140,000 bed capacity between the hospitals and the overflow facilities. We're also scouting dorms, scouting hotels for emergency beds.
Now, days ago, the angle had started to crunch the real numbers from both Italy's COVID experience and China's. And the dire warnings that hundreds of thousands of ventilators were going to be needed and potentially millions of Americans, that's what they were saying, could die, neither of which matched the new data that we were looking at. Now, these projections were based on a model done by the team at the Imperial College in London. Well, today, this is what our instinct was, the lead researcher did an about-face on those terrifying projections, the very projections that drove so much of our response.
That was the report that said there would be 500,000 deaths in the UK and 2.2 million deaths in the United States. They've adjusted that number in the UK to 20,000. The predictions of the models don't match the reality on the ground in either China, South Korea, or Italy. When people start talking about 20% of a population getting infected, it's very scary. But we don't have data that matches that based on the experience.
And that data of actual COVID hospitalizations and ICU needs informs the question of how many ventilators will be needed. And the nightmare scenario floated that we'd have to then ration care.
Right now, you can see these cases are concentrated in highly urban areas. There are other parts of the states that have lots of ventilators and other parts of New York State that don't have any infections right now. So we can be creative, we can meet the need by being responsive. But there's no model right now, no reality on the ground where we can see that 60 to 70% of Americans are going to get infected in the next 8 to 12 weeks.
Now, it appears that Governor Cuomo's dire projections are also based on that original faulty model that didn't include the clinical reporting by the Chinese and Italian healthcare professionals. Now, as viewers of this show, you were already aware of the faulty modeling done on COVID because I asked Dr. Fauci about this on Tuesday night. If the numbers are not right, then maybe that affects the decision-making about when the country can gradually get back to business.
You're absolutely right, Laura.
Well, on both the issue of promising therapies like hydroxychloroquine and on the analysis used for these doomsday predictions, the Ingram angle has been days, if not weeks ahead of some of the major news networks, frankly, all of them. Now, why is that? How is that? Because I was lucky enough to assemble my own team of medical advisors, and you all know who you are out there. And they were raising all the right questions, stuff that I wouldn't know about, but they do. And they actually are people who treat COVID patients day in and day out. Many of the so-called experts, I was thinking about this today, have failed us in the past on really key issues. Think about Iraq. Think about trade with China. Think about the importance of border enforcement, the internet bubble, the housing bubble, and now the CDC's COVID testing. Time will tell just how accurate or inaccurate the experts were in this crisis. Was a total shutdown the right way to go? Or should we have taken a more modified approach, more akin to what Sweden is doing? Should we be waiting for this thing called herd immunity to develop, or just force everyone to isolate and hope the second wave of infections never comes? In the meantime, we're lucky to have a president who trusts but then verifies what the experts are saying. And then he balances it with the overall needs of the American people and the American economy. He announced today that he'll be releasing new guidelines to the governors for a gradual relaxing of the shutdown in the areas that have managed to escape the worst of the virus.
We do have 19 out of our 50 states, to be reminded, that had early cases but have persistently low level of cases, and at this point have less than 200 cases. So that's almost 40% of the country with extraordinarily low numbers, and they are testing. These 19 states are doing still active containment. They're at 200 cases despite the fact that they've been measuring them over the last 3 to 4 weeks.
But even then, if those areas see restrictions lifted soon, it doesn't mean that people should just go about their merry way like before the virus. That's not what the president, I think, is going to advise. They should not still let their guards down.
I want those guidelines to go even when we're open and fully operational. And frankly, much of the guidelines, like shaking hands, maybe people aren't going to be shaking hands anymore when we're open. As soon as we open, that doesn't mean you're going to stop with the guidelines. You'll still try and distance yourself, maybe not to the same extent because you have to lead a life. But I think the time is coming.
How about common sense? When will that reign supreme again? Well, he understands that the virus or no virus, if people don't have a way to make a living on the other side of this, if things collapse, businesses go out, bankruptcies, restaurants go under, jobs never return, certain types of jobs don't return, well, the long-term damage to America will dwarf what this hideous virus has already done to us. And those are my thoughts at the end of America's shutdown, day 10.